Smoking not only damages your lungs and your circulatory system, it also damages your skeletal system by weakening your bones. A study published in Clinical Science suggests that smoking is a key lifestyle risk factor, in other words, a behavior chosen by an individual, and appears to be independent of other risk factors for fracture, those which we have no control over, such as age, gender, and menopausal status. In 2000, University of Kentucky researchers reviewed the medical records of 357 spinal fusion patients. About 3/4 of both non-smokers and those who kicked the habit while healing recovered well enough to return to work, compared with just half of those who are still smoking post-surgery. Doctors Frank Bono and James Ronzo of Gulfcoast Spine Institute know firsthand the effects smoking has on a patient's ability to heal.
Smoking, it deteriorates everything. Soft tissues, bones, especially if certain surgeries, the healing time, it takes smokers a lot more to heal. If we have to do a fusion, I won't even do the fusion if I know the person's a smoker. They have to quit before and as well as after, because nicotine stops the blood flow for healing. It weakens the bone over the course of time. It slows the circulation. You can see it on skin as well. It just kind of ages you.
It's obvious that when people smoke that they're going to deplete their body of oxygen. And oxygenation of the tissues is very important in healing, especially after surgery. So if somebody's had a surgery, whether it's on the bones or not, the skin and the soft tissues below the skin incision still need to heal. And if you deplete the body of oxygen, you're going to interfere with the body's ability to heal those kind of incisional scars and pains. For the body to repair itself and grow bone, it needs oxygenation as well as nutrients for the body to be able to produce new bone growth. When somebody smokes, they get the nicotine in their body, and nicotine directly affects what we call angiogenesis, or the body's ability to grow small blood vessels. It's the small blood vessels that bring in the nutrients for the bone growth.
Most of my population does not smoke. My patients 65 and above, they don't smoke. Did they smoke? Yes, because that was a big thing in the 60s, 70s, but most of them don't smoke. Younger population, patients 50 and under, you see a lot of smoking. But these older patients, they're smart. They've lived.
While the link between smoking and bone damage is clear, no one knows why it occurs. Nicotine may not play the only role. There are dozens of toxins in cigarette smoke. You'll find links to help you quit smoking, as well as information on Gulfcoast Spine Institute when you click the Smoking and Bone Loss Story link on our homepage, yourhometownhealth.com.